Did you know that low ferritin can be the root cause of a whole bunch of symptoms, including chronic fatigue, hair loss, thyroid problems, and cortisol imbalances? That's right. Despite the fact that most doctors don't even measure ferritin, having suboptimal levels is a very real, very common problem. If you have or suspect that you have low ferritin, keep watching because in this video, I'm going to show you how your microbiome might be sabotaging your ferritin levels. And I'll share some strategies you can use to assess and solve the microbiome problems that keep you from achieving and maintaining healthy ferritin levels. Low ferritin is frustrating for several reasons. It's frustratingly common. An estimated 2 billion people suffer from it across the world. It's frustrating that many doctors don't measure it, despite how common it is. It can be frustrating to try to increase low ferritin levels, for lots of reasons, one being the topic of discussion for this video. And low ferritin causes lots of frustrating symptoms. Here are a few examples. Hair loss. This is one of the big ones I see in my clients, along with other micronutrient deficiencies or insufficiencies. Fatigue, weakness, headaches, and dizziness. If you have long-standing fatigue, one of the first things you need to do is check your ferritin. Anxiety, depression, poor focus, lack of recall, and an overall decrease in brain function. I had one client whose anxiety almost completely resolved once we got her ferritin into the optimal range. The brain and its functions are very sensitive to latent iron depletion. Hypothyroid symptoms, like sensitivity to cold, constipation, dry skin, weight gain, puffy face, muscle weakness, and even menstrual cycles that are heavier than usual or irregular, can be linked to low ferritin, because iron is crucial for the conversion of inactive T4 thyroid hormone to active T3 thyroid hormone. It's true that most of these symptoms overlap with other root causes, but you shouldn't overlook the role of iron reserves if you're struggling with these kinds of issues. Speaking of iron reserves, we'd better make sure that we're on the same page about what ferritin is and what it does in the body before we talk about how the microbes in your gut can impair or improve your ferritin levels. Ferritin is a protein that stores iron in your cells, safely transports it in the blood, and releases it when your body needs more iron to do important things like make your red blood cells and bind active thyroid hormone to receptors. We need ferritin because while iron is a super helpful micronutrient for your body, free iron is actually toxic to your cells, so it needs to be bound up or buffered when it's stored. That's ferritin's job, to keep a reserve of iron that's ready to go when your body needs it without exposing your cells to harmful free iron. When you have adequate iron in your blood, but not enough ferritin, we call it latent iron depletion, or sometimes iron deficiency without anemia. So when we measure your levels of ferritin in the blood plasma, we get a sense for how much of a backup stash of iron your body has at its disposal, as opposed to only measuring iron in your blood directly, which is more common than measuring ferritin. Even if your iron blood test comes back within the normal range, it doesn't necessarily mean that you have enough reserve iron, stored as ferritin, to maintain all of the functions of your body that require it. Given that ferritin is the most sensitive biomarker for assessing iron stores, it's frustrating that more doctors don't bother to check it, even when their patients have common symptoms of low ferritin. If you suspect that your symptoms are related to low ferritin, it's a good idea to test it via blood work. Most of the time, you can ask your primary care provider to order this test for you, especially if you tell them that you're feeling fatigued or have other symptoms associated with low iron levels. But be sure to specifically mention ferritin. Otherwise, you might just end up with an iron test, which is not the same. If you'd like to order your own ferritin blood test, you might be able to do so through my website. I'll put a link in the video description for more info about this option. For reference, I like to see optimized ferritin levels of 70 to 300 micrograms per liter for males and 70 to 150 for females, unless they have thyroid disease, in which case that bottom number goes up to a minimum of 100 micrograms per liter. All right, Now you know what ferritin is, why it's important, and the types of symptoms it can cause if it's suboptimal. You also know what range you're looking for and how to get your ferritin tested. Next, we can talk about how your microbiome can get in the way of raising low ferritin levels and maintaining healthy ones. One quick note before we go any further. There are many reasons for low ferritin that don't have to do with your gut microbiome. So if you get to the end of this video and you're looking for more, be sure to watch the next one too. I'll make sure it's all queued up for you. So let's start with some basics about the microbiome. It's made up of at least 500 species and roughly 3 pounds of bacteria that live in and on your body, mostly in the intestinal tract or the gut. The microbiome performs so many crucial functions that you couldn't function without it. It regulates your immune system, drives metabolism and energy utilization, makes crucial micronutrients for your cells, like vitamin K and short-chain fatty acids, and plays a huge role in the function of your digestive system. It even influences mood. Scientists have found that your gut microbes are responsible for producing 90% of your serotonin neurotransmitter, the hormone in your brain that's often poorly regulated in depression. More specific to our topic, the microbes in your gut can make or break your ability to absorb micronutrients like iron. And if you can't absorb iron from your digestive tract, it's going to be really difficult to raise low ferritin levels and even harder to maintain optimal ones. One particular bug that's both common and disruptive for iron absorption is called Helicobacter pylori, or H. pylori. H. pylori can cause atrophic gastritis, a condition where the cells that line the stomach morph, losing their ability to secrete gastric acid, which is crucial for iron absorption. In fact, elevated H. pylori is the most common cause of atrophic gastritis, and approximately 60% of the world's population is infected with this common bacterium. Think about it. If you're consistently taking a high-quality iron supplement or eating tons of iron-rich foods like clams, oysters, organ meats, spinach, tofu, and beans, but H. pylori is effectively blocking your ability to absorb the iron in these foods, then you're not going to see those levels improve. And H. pylori isn't the only bacteria influencing iron absorption. Several other strains of bacteria have been found to sequester iron, resulting in lower absorption. This is one of the reasons that having too many gut microbes, also known as dysbiotic overgrowth or SIBO, can result in lower ferritin. On the flip side, there are bacterial strains that help the body regulate and increase absorption of iron when needed. I think of these friendly bugs like micronutrient doormen because they help ease iron's entry through the intestinal wall. One of the specific strains that's been found to boost ferritin is Lactobacillus plantarum. One study found that a probiotic containing this strain increased iron absorption by 50%. So how can you tell if your microbiome is keeping you from having healthy ferritin levels? A comprehensive stool analysis will tell you. There are a few good test kits on the market, but I recommend one that tests for H. pylori and its virulence factors, which helps you determine how pathogenic the strain is in terms of ulcer and cancer risk, which is really good to know when you're deciding how to treat it. It also tells you if your H. pylori is antibiotic resistant, which is another big bonus. And of course, you'll be able to assess for additional microbes, including yeasts, viruses, and parasites, as well as tell if you have too many or too few bacteria in your digestive tract. There are a few ways that you can get your hands on one of these tests. If you're located in the US, you should be able to order your kit via my DIY testing service, and I'll even help you interpret the results. If you're outside the US, you can apply for a functional case review. You'll have the option to request the comprehensive stool analysis, and I'll assess it as part of your report and protocol. Speaking of the case review, if you already have gut testing or other labs that you need help figuring out, this is a great opportunity to get my analysis and recommendations without committing to becoming a one-on-one client. I'll put links to more info about all of these options in the video description, so be sure to check that out. If you discover that H. pylori is a problem for you and you want to get rid of it, you need some iron absorption boosting probiotics, or you'd like to see my other recommendations for raising low ferritin, be sure to download the free ferritin boosting checklist. You'll find all this goodness inside, as well as a link to order my suggested ferritin boosting nutraceuticals for a really nice discount. Hopefully, this video gives you the next step you need to take control over your ferritin levels and restore your energy, vitality, healthy hair, neurologic function, and whatever low ferritin symptoms you're dealing with. If you did find some useful info here, be sure to stick around for the next video that details several other root causes of low iron and ferritin. And be sure to check the video description for those links. There's some good stuff waiting for you. Thanks so much for watching, for liking this video, and for subscribing to my channel. Your support helps other people find the functional medicine strategies that they need, and I really appreciate it too. We'll see you in the next one.